Okay, good morning, everyone. Thank you for joining us today for the NHR Research Professorships webinar. I'll run through some housekeeping rules in the agenda, but first some introductions. I'll introduce myself first. My name is Tom Pratt. I'm a Senior Programme Manager at the NHR Academy, and I currently manage the Research Professorship Scheme. And I'll let my co-host introduce herself.
Hello everyone and welcome. My name is Nadine Foster and I was an NIHR research professor and I'm a physiotherapist. So I'm going to be talking a little bit about my experience later on. Thanks, Tom.
Okay, and very grateful to Nadine giving up time from her evening down in Australia. So as Nadine said, she's the only person who has been a research professor and is now a member of the selection committee as well. So we're very grateful for her to come along and bring her insights from both sides of the scheme. Okay, so in terms of the agenda for the webinar today, I'll be running through some slides initially to just go through the context of the scheme, just run through the eligibility and the application process and the timetable for the current round. Then I'll hand over to Nadine, who will just give her reflections and tips, as I said, as both a research prof, as an HP, and also as a current selection committee member. And as I said, we'll try and allow as much time as possible for questions and answers and try and get through as many of those as possible. Okay, I think just in the chat, I think there's someone who's got some audio issues, but I think that's been sorted. So we'll just start the webinar. So just some context for the NHR Academy. So there's quite a few different centres as part of the NHR. It's a very big organisation, but the NHR Academy that I work for is very much focused on research capacity development. So we're looking to build a research faculty that is for health and social care in this country and also globally as part of the Global Health Programme. And the way we're looking to do that is to offer training pathways to develop leaders for the future and also try and offer these at a range of different levels to suit different working arrangements, different professional backgrounds, and of course, very different career paths. So in terms of the structure of the NHR Academy schemes, I work in the team that manages the pathway at the top, the fellowships for all professional backgrounds. So it starts at pre-doctoral, doctoral, postdoctoral, and of course, the research prof that we'll discuss today. Some of you may be aware, particularly given the focus of today in terms of the ICA scheme that Nadine was involved with previously, which is aimed at a large range of professions. I know on that diagram we've labelled it as non-doctors and dentists, but the aim here is to have a pathway for whether that's nurses, midwives, AHPs, healthcare scientists, pharmacists, and a range of different professions that require professional registration. There is a scheme for doctors and dentists that's at pre-doctoral and postdoctoral level. And then also we try and involve people in the infrastructure, whether that's the BRCs or the schools, through the various different training options there, and also linking in with the incubators, such as the nursing incubators, who were very keen for this session to be put on. So today's focus is the research professorships. So this is the most senior fellowship offered by the Academy, so our most senior personal award. And in terms of what the scheme is, so it's an annual round that started in 2011, and they open annually from September to November, although the closing date this year just touches into December. So it's a 5-year award. And what that comes with is the salary for the lead applicant, the research prof themselves. There are 3 support posts. These have traditionally been a 5-year postdoc, a 3-year postdoc, and a 3-year doctoral. We try and flex that if that's necessary, particularly for the global health side, because that might not be the most efficient use of the support post in terms of configuration. But the idea is to start building a team that the research prof can build on, along with some match funding from the host as well. There will be research costs for the proposed research, and there's also the key factor is that the training costs for a bespoke leadership and development program that the research prof will propose. So we're very keen to stress to anyone that we talk to that this is open to any professional backgrounds, whether that's clinical or non-clinical. We'll have some statistics that I'll show after Nadine's done her slides in terms of the types of people that apply and success rates. But we're very keen to focus on the broad range of people that NIHR funds, that this award is also open to everyone. The research professorship scheme is open to universities in England, given the nature of the funding. If you're applying for a global research professorship, that is a little bit different. And there is a webinar on that was done in September if you want to know a bit more detail about the global research professorship. So the research professorship is quite unique in terms of the nominations are made by the universities before they come to us. So traditionally there's been a maximum of 2. We introduced a rule in 2017 that if 2 nominations were going to be made, that at least 1 must be female. This was in response to the number of applications we were getting that were male, and the success rates weren't different. It was just the number of males being put forward. So that has seen a leveling up of the number of people awarded, which has been a success. We have also introduced a 3rd nomination, and there is details in the guidance notes that if someone is if a new university is making a 3rd nomination from an ethnic minority group, then that means we can increase the number of nominations made by each university. So I'll just quickly run through what we're looking for, and Nadine will touch on this in some of her slides as well, but just to give a brief summary in terms of the nominee, the eligibility is that you will not have been at your current level of seniority for more than 5 years and be on an upward trajectory. That level is whatever your current level is. So if you're a senior lecturer or a reader or a prof, that you kind of been at that level for 5 years. If you got a subsequent promotion, that would reset the clock for the 5-year period. The upper end of that is if you've been a professor for more than 5 years, you're deemed to be beyond the scope of the scheme. So looking for a strong track record, whether it's health, public health, or social care research, and you should already have good collaborations and partnerships and look to build on those, and then also propose what new ones you make during the award. In terms of the research, the committee will be looking for a quality research program, also that provides or produces during the award, but the panel will also be looking at what the likelihood is of further funding beyond the award as well. As I mentioned, in terms of global health research profs, there is the extra criteria of making sure that it's in line with the official development assistance or ODA eligibility as well. So there's more details in the guidance notes for that. And then obviously the key part of a personal award is the training side. So for the research profs, they're looking at a strong leadership and development program. And also what is coming more into focus, particularly in recent years, is what is the commitment of the proposed host institution and their partners as well to support the nominee in the short term, the medium term, but also the long term beyond the award. So in terms of the timetable for this year, just to give you an idea of what's to come. So the round opened at the end of September and closes on the 1st of December. The next period will be shortlisting, that we'd send it to the committee members. So that normally takes around 2 to 3 months, and then we'll let everyone know the outcome in March 2022. There'll be a period of external peer reviews because our committee is quite wide-ranging in their expertise and backgrounds, but they're not experts in everything. So we have that extra stage to go in experts in those particular fields for further reviews. And then the interviews will take place in June 2022. The exact format of that is to be decided in terms of whether that will be Zoom or face-to-face. And then start dates will be from October, November, and December in 2022. So just some quick process-based tips that I just wanted to highlight to everyone. The application process is a single-stage application on our system called Aramis. So what we would always recommend is registering on Aramis as soon as possible. The application can be quite a long process, so you want to allow as much time as possible. Whether that's for future rounds as well, I'd still recommend getting registered on Aramis and getting some of the CV details up to date that can be done at any time. Review the guidance notes fully and make sure you're eligible. There's nothing worse than going through the whole process of applying and then finding out from our team that you're not eligible and it doesn't even get to the committee. If you're unsure, then do get in touch with our team at the Academy and we can always just double check this. I'd recommend getting in touch with your finance office and any required signatories as early as possible. Closing dates do tend to come up quite quickly, and every year we'll always have some panicky calls from people to say that their head of department or their signatory is on holiday and they hadn't realised, or the finance office haven't given them enough time to approve the budget. So make sure that those people that need to have involvement in the application are well aware in advance. And the last hint from me is make sure you do a comprehensive spelling and grammar check. It's always a bit of a surprise when we have the first stage of remit checking that our team carries out, how many spelling mistakes there can be. And in terms of making a good first impression, it's making sure that you do that check and maybe get some other people to have, you know, some fresh eyes on it as well. So those are my slides now. So I'll hand over to Nadine, who will talk you through her slides. Over to you, Nadine.
Thanks, Tom. So obviously all our careers are very different. Please don't take it from my example that this is the only kind of career that is going to be funded by one of these research professorships. As you all know, there is no easy clinical research pathway for the non-medical health professionals, and all our careers are very different. But what I thought would be useful is to give you an idea of where was I at the time of application. What did my CV look like? You know, where was I at really in terms of my career? I'm then going to essentially share with you what I offered the NIHR as part of my research professorship application. I'll say a little bit just about what happened during the award, where I'm at now, and then finish with some hints and tips now that I've joined the selection panel for these awards. So I really hope this is useful. And you can glean some insights from this example. So firstly, where was I? So my background is physiotherapy. I qualified in 1993, and I was an early enthusiast for research and did a PhD early in my career, which meant that I had a strong trajectory, I guess, in allied health research, particularly in my field, which was back pain, and then over the years expanding to other musculoskeletal research conditions, and very broadly encompassing a health services research programme. I was based in a multidisciplinary university research centre with a joint research strategy and an honorary contract with our NHS partners. And that was several trusts all coming together with our research centre through a formal research consortium. So there was very good partnership between the research programme that I was doing and leading and its pull and push through to and fro our NHS partners, both in hospital settings and primary care settings. I applied for the very first round of the NIHR research professorships, and that was way back in September 2011. And you get to, at least at that stage, you had to categorise your research, and I chose the health services research category in the application form. I was subsequently successful, so I held the award between 2012 and 2017. So because this was the very first round of the research professorships, I was the first non-medical allied health professional to hold one of these awards, and there were 5 of us in that very first funded round. So if we move on, Tom, to the next slide. So a little bit about where was I at in my career when I applied. So in March 2010, I had been internally promoted at the university into a professorial role. So I was a professor of musculoskeletal health. I was also just recently taking up a director role of our clinical trials unit. So that was the stage at which I was then made aware of this award. The call came out summer 2011. So I had been in a professor's seat for just over 1 year. I was also engaged nationally and internationally in my field, as you would imagine, in areas that are related to my research. So I've given you some examples there, both in terms of musculoskeletal pain, national and international groups, as well as NIHR panel members. So understanding nationally the NIHR funding schemes and being involved in those. In terms of grant income, when I look back, I probably had around £11 million in terms of grant capture at the time of application. And that included roles as chief investigator, but probably more roles as what I would call a principal investigator. So examples such as the sort of second person leading that trial, or the lead of a work stream within a program grant or a program of research. So that's That's the kind of stage of career I was at. But I had a good funding track record from NIHR. I had some funding from MRC and also had a good track record with Arthritis Research UK, one of the big charities in my field. You'll see that what I offered was largely a programme of randomised controlled trials as part of my research professorship. And at the time of application, I had a good trials track record with about 7 completed RCTs and 2 completed implementation impact analysis studies with full cost effectiveness analyses in the fields of interest that are related to my work. So osteoarthritis, back pain, exercise, and models of care like stratified care, telehealth, and so on. I think importantly, when I look back, I had been involved in some of the largest trials in the field in some of these areas. And obviously that also was pulled through then into good quality publications in some of those top general medical journals. But I also had lots of publications in pain specific and also in discipline specific, such as allied health journals. I was developing good international collaborations around the world, and I had around 80 peer-reviewed published papers at the time of application. In terms of research capacity development, I had supervised 7 PhDs and 13 masters to completion, had 4 PhDs in progress. Crucially, I think they were multidisciplinary in nature, and I'd also had several years supporting a team of postdoctoral researchers, so supporting others going for particularly NIHR and Arthritis Research UK fellowships. I'd had a strong contribution to the most recent RAE at the time, now REF, of course, in 2018. And I had held a previous personal fellowship, a Primary Care Career Scientist Award for 5 years, 2004 to 2009. That was funded by something called the NCCRCD, which actually was part of the predecessor of the NIHR. Of course, the NIHR only started life in 2006. So I hope that gives you a sense of where I was at in my career just as I started. And then what I'm going to do is just explain to you what I offered the NIHR, and these are literally the slides that I used in my presentation. So I'm going to speak to them. My research programme focuses on musculoskeletal problems in primary care, including low back pain, knee pain, and shoulder pain. These are the most common and costly conditions, both in terms of impact on individuals and society. For example, at any one time point, about 1/3 of adults will have back pain, costing the NHS $1 billion per year. This slide shows I'll just go back, Tommy. This slide shows the number of patients consulting with different problems in a typical general practice with 10,000 registered patients. And you can clearly see that musculoskeletal problems represent the second most common reason for consultation. The burden of these problems is set to rise, but our health services are facing financial pressures with expectations of cost savings. And our research centre is the only unit in the UK where we're dedicated exclusively to researching musculoskeletal problems and treatments in primary care. And I, as a research lead within that centre, am committed to optimising primary care for musculoskeletal patients. So my research programme takes a systematic approach across the range of primary care, from the development, piloting and testing of complex interventions and specialist services in high quality clinical trials that test their efficacy, effectiveness and cost effectiveness, through to implementation studies which have real impact on service configuration. And this award will make a further step change by supporting my health services research programme over 3 components. The first component is a programme of high-quality randomised trials that will deliver best evidence about treatments. These trials focus on the most promising non-pharmacological interventions as well as novel models of care, all driven by patient concerns. They include a suite of 5 recently funded feasibility and pilot trials across the range of musculoskeletal problems, as well as 2 main trials that are delivering definitive results. An example is the study of working pain, or SWAP trial, one of my cluster randomised controlled trials funded within an NIHR programme grant, where we're testing the potential of a new vocational advice service in general practice for early identification and support of working-aged adults with musculoskeletal conditions. Another example is our BEAT trial, which stands for Best Evidence about exercise for knee pain, a 3-arm parallel trial testing clinical and cost effectiveness of different ways of delivering the core treatment of exercise for older adults with knee osteoarthritis. It will provide both short and long-term data on the clinical and cost effectiveness of different ways to support this sustainability of exercise interventions, including whether fewer patients proceed to surgery. The 5 pilot trials are planned to inform the full definitive randomized controlled trials within this 5-year period, with funding targets including the HTA and Arthritis Research UK, such that a rolling programme of high-quality trials that benefit musculoskeletal pain patients in primary care is delivered. The second component of this research programme is a new research programme focused on stratified primary care for musculoskeletal patients. So this work is essentially about helping clinicians to better spot which patients will and won't do well, and then more systematically matching those patients up with the right treatment. The model of stratified care involves identifying subgroups of patients with shared prognostic characteristics that are modifiable, using simple-to-use clinical tools to assist clinicians' decisions about treatment. So it's about matching patients with the right treatment. This pyramid, and this is an animation form, so you could just bring it all in. This pyramid summarizes our stratified model of care for back pain patients in primary care with 3 subgroups of patients based on the risk of persistent disability. And on the right, the 3 matched treatments. This work was supported by NIHR through my previous Primary Care Career Scientist Award and my current postdoctoral fellowships for members of my research team. In a randomized trial published this October in The Lancet and in an implementation study, we've shown this stratified care model to be clinically superior and cheaper to deliver than usual care. In this second programme of work, we will develop and test a similar prognostic stratified care approach for a broader group of patients with musculoskeletal pain in primary care. So this move is a stepped approach. So step 1 was to develop and test our stratified care model in one index condition, and that was back pain. Step 2, in 2012, we'll see the development and early testing of our new screening tool and will involve secondary analyses and updated literature review and face validity testing. And step 3 will involve applying for a new NIHR 5-year applied programme grant to conduct full validation of the tool, develop the matched treatments, train and support clinicians to use them, followed by a pilot and full randomized controlled trial. This programme of work is world leading and has the potential to significantly change primary care for musculoskeletal patients. And lastly is the final component, which involves leadership and development of the research and clinical teams. All of these studies involve multidisciplinary teams, and each will provide essential principal investigator experience for 6 postdoctoral staff, thus further building capacity for this area of research. For me, this will support my transition from predominantly a PI role to a clear chief investigator role, where I can focus more on expanding and securing long-term funding support. This 5-year programme of work is ambitious and is based on high-quality science and strategies to ensure translation into patient benefit. I will use this award to increase my visibility in the NIHR and to further develop my ability in partnership with the NIHR to influence the national applied research agenda. So I'll come out of that. Those were actually the slides and the words that I used in my presentation. To give you a sense of what I offered the NIHR that they subsequently funded. During the award, one of the things I was asked in my interview is what would I give up if I was offered this award? So how would I create the room and time in my working life to do this 5-year programme? And I stepped back from being director of the clinical trials unit whilst I was doing this award. Through the 5 years of this award, my grant income grew considerably to more than 35 million. And I did get that NIHR applied programme grant. Of course, there's healthy amount of luck involved in that, but that was very helpful because then, of course, I could get on and do some of the work that I was articulating as new work within this programme. The research professorship supported part of the development work for that NIHR programme grant in 2011-2012. And that then positioned this very strongly for that NIHR applied programme grant submission. It supported my salary, a clinical academic physiotherapist, PhD, a postdoc physio for 5 years, 2 interns, both allied health professionals, and that was on top of the institutional support where they recycled my salary to support postdoctoral research fellows in my team. Just to be clear, my substantive funding was never under threat. So it wasn't that I was ever feeling vulnerable in terms of funding. There was a lot of reassurance from my host institution that, that it wasn't the case that at the end of this 5 years, I wouldn't have a clear role going further. But during the 5 years, of course, I grew this musculoskeletal research team within the Research Institute, grew the team, attracted new staff from other bases in the UK, as well as hosting overseas visits and collaborations. And I personally grew, of course, in my senior research leadership roles. I got much more involved in the NIHR. I was already, of course, involved, but I got even more involved. I became the NIHR lead advocate for physiotherapy, supporting others to know about NIHR awards and help them and mentor them through fellowship applications. I became the deputy chair and then the chair of the NIHR Health Education England ICA Clinical Doctoral Research Fellowship Scheme, which many of you will be very aware of and perhaps supporting people within that scheme. I became the chair of the Research for Patient Benefit Committee in the West Midlands, and I supported many NIHR events, including the 10-year anniversary event that showcased the Research Professorship Scheme in May 2016. And then I subsequently got more involved in the NIHR. I became an NIHR senior investigator and sat on the NIHR and senior investigator panel for 2 years as well. So lots of NIHR involvement. And so moving then on to the next slide. So literally just this year, I've made a big move from the UK to Australia. Very much, of course, significantly facilitated by the NIHR investment in my career and my research. I suppose the role that I'm now in wouldn't probably be possible without this background. So I'm now a conjoint professor leading an alliance between the University of Queensland and the biggest hospital and health system in Australia called Metro North Health. Obviously, throughout my career, I've done a lot of trials and a lot of testing and health services research and models of care. And that research has had significant impact, both in terms of reach around the world, but also in terms of changing healthcare services in countries such as the UK and elsewhere. I've gone on, of course, to supervise more PhDs and more postdocs and become a passionate advocate for clinical academic and clinical research career pathways. Hence my willingness to help with Tom's webinar today, because I really believe these awards make pivotal differences to your career. And just this year, I've also then been invited to join the NIHR Research Professorship Selection Committee. And I think that's probably helpful to the committee as I'm now international rather than in the UK. And that brings me then to my last couple of slides, which is just to share some insights from my early time being on the Research Professorship Selection Panel. The first thing I want to say to really try to reassure you is that they are super keen to see the number of applications from nurses, midwives, and allied health professionals increase. So absolutely, they want to see you apply. What's particularly important, and Tom, just bring all of these in and I'll speak to them. I mean, without a doubt, I guess, as you'd imagine, these are the top awards in the NIHR schemes. So research excellence is needs to sing in spades, as you say, as I might say. There has to be high quality and high volume of internationally excellent research with clear outputs that have had clear impact. But also important is research leadership, so clear evidence in terms of securing funding to date, and also a real likelihood of further funding. So they're looking for someone who has leadership and potential, someone who's clearly leading things rather than only contributing to things. And the way I would also put that is almost like a clear and steep trajectory. So if you look at your publications, if you look at your grants, if you look at your impacts, can you see that there's a clear and steep trajectory in your last, let's say, 5 years of your career? If so, then you're probably someone who should be seriously considering this type of award. Also really important for the selection panel is a very clear, articulated level of support from the host institutions. So personal, real and meaningful support, more than just simply recycling the savings of your salary, something that really sings the value of you as the nominee to the hosts around you, to your university, to your hospital, to your health system. And finally, also, capacity development is really important. Being in the NIHR for as long as I have, I don't think I've ever come across an organisation that really promotes capacity development as much as the NIHR. It is super important, not just to do well yourself, but to bring along others around you to do well also. And so the PhD completions, the postdoc support, the internship support, all of that's going to be really important in this application, so they can see that you are someone who's going to really not just look after your own career, but look after the careers of others. And my final slide is a few hints and tips from being on a panel. What do we see that means people don't get through? And I guess commonly the conversation is this person looks like a good candidate, but there are real challenges or problems in the research program. Or that this person has some leadership demonstrated in the application, but tends to be a leader of multiple small grants. And by small grants, typically what I mean are grants of the kind of perhaps small charitable grants that are around 20, 50,000 pounds. And that's mostly the research leadership. But where those larger grants are on that person's CV, they tend to be only a co-applicant. So that makes the panel question whether this person is really leading the level of research that they're after to award them the top NIHR Fellowship Award. Other things that we see are perhaps low volume and low quality publications that have a questionable leadership role in the team. So, perhaps someone who isn't singing many first or last authored publications. And I know that we can all debate whether that is a reasonable approach or not, but certainly they look for, again, this evidence of leadership in the outputs and impacts. There can be quite a good discussion around this tricky balance. You want to sell a really compelling vision to the funding panel. Sometimes that tips over into a sense that this thing is unfeasible. It's just too big in scope. They haven't nutted it out really. It's not feasible. And again, I note that that is a tricky balance, because if you're not visionary enough and painting a very compelling story about the difference your research will make, then that will be criticised. But equally, you want to try to come across as knowing and demonstrating that this research is actually feasible. Some candidates are criticised because we can't really see a coherent overall plan or vision. We can see lots of work packages and lots of aims and objectives, but it's really struggling to get that big picture vision across. And that's what grabs the attention of the panel, as you can imagine, to really get them hooked into the importance of the whole programme of work. And as linked to that, I said some applications are criticised because they have so many objectives, so many work packages, so many unknowns being articulated that the whole thing comes across as just not feasible. Tom's already mentioned some simple problems around errors and lack of clarity. The panel also sometimes have conversations around it's hard to see the added value of this research professorship. So sometimes people come in with applications and there's a bit of discussion around whether they even need this award, whether they're going to do really well anyway, whether they're going to do this work anyway, even without this award. So the panel, as you can imagine, because they only have 5 of these to offer per year, they really want to offer it to people that they can see it's going to really help them fly. It's going to really make a difference. And I'm not picking on BRCs, but it's interesting, I find, that sometimes those conversations are particularly in a context of where someone is in a place where there is lots of other resource, and a BRC would be a really good example of that. Sometimes also, even though this is the top NIHR award in their schemes, and you would think people coming to this award would understand just how important public and patient engagement and involvement is, sometimes we also see applications that come across as rather limited in terms of PPIE. So those are my insights from being on the panel so far. I hope they're useful. But I guess just a few final words from me. Please spread the message that the panel really want to see applications from our disciplines. We do punch above our weight, and we need to be, pretty brave and go for it. And even though you'll see some statistics soon that might make you think, it's not worth going for this. That's not the case. They really want to see applications grow from our disciplines. And I believe we can help each other across our disciplines to be successful. So I have this award, I'm a physiotherapist, and we also have a dietitian who's been successful from our disciplines with this award. So please consider applying. If you do, please be tenacious and please get support. And I'll stop there. Back to you, Tom.
Okay, thank you very much, Nadine. As Nadine mentioned, I've just got a couple of slides showing some figures. The first one's quite stark. So this is in terms of, since the first round in 2011, the number of applications that we've received from nurses, midwives and AHPs. As Nadine's mentioned, in terms of the AHPs awarded, we had Nadine herself in round 1 as a physiotherapist, and then Ashley Adamson, a dietitian from Newcastle, in round 2. So, I mean, the numbers that we've received are quite low, but in terms of some statistics from the last 3 rounds, in terms of, I've grouped them quite broadly, but just to give an idea of the success rates that we've received. So the highest number in terms of professional background is the medics and dentists, with success rate of 16.4%. But in terms of other health professionals, recently we've seen a number of psychologists that have been funded. And in the not a health professional area as well, we've funded statisticians, health economists and engineers recently. So I think the success rates aren't that different. It's just the volume of applications that seems to be quite different. So that's an area that we'll be looking to consider as well, and might come up in the Q&A. So just a couple of links, and these slides will be shared afterwards, and there will be a survey you can indicate if you'd like the slides, but just some links. Obviously the first one that I hope a lot of you have seen is the page on the NHR website with the guidance notes and other information. We also have a page that lists the current and previously funded research process as well, so you get an idea of who's been funded previously and the work that they've done. There is also a website that shows all of the funding that NHR has given across all awards as well. So again, you can look at topic areas as well. And also a blog from one of our global research profs on his journey to get this award as well, and his journey of career development and capacity strengthening. But with that, I'll stop sharing my screen because we've got quite a few questions coming through. So I'll try and get through as many of these as possible. Obviously trying to make the most of Nadine's time as well, because if you've got any process-based questions, I'll try and answer these here, but also you can get in touch with myself or the team at any time. So I'll start with one which is a question and a compliment for yourself, Nadine, which is from Jane, who says your track record at the point of applying looked incredibly impressive. Is that the level of expectations in terms of 80+ papers and the number of completed PhDs, etc.?
And look, that's why I front-ended the way I did, which is that all our careers are different, and there is no one, blueprint for these awards. But I think volume and quality of publications and evidence of research capacity development is important. So I wouldn't be being genuine if I gave you the impression that quantity and quality of publications isn't a key thing that will help get your application over the line and get you into the room, as I call it, to be interviewed. So whilst 80, I don't know whether 80 is a lot or 80 is a little. When I look at applications coming through, this time and being on the panel, it is very varied. Some people, for example, have been in methodological research positions for many years, and they have many more publications than 80, whereas other, often clinical academics might have fewer. So there isn't a right or wrong, but definitely quality and quantity of publications and evidence of research capacity development. These things are important indicators that will help get your application over the line.
And I would say, I mean, if people call the team as well and asking for, some questions around the application form. So we do have 2 sections early on. So the first is the CV section. So that would be where you'd list the publications and grant income and your employment history. And then the next section is the applicant research background. So that's where you can start your narrative, if you will, about your career journey and really bring it to life. Because obviously, I think when you're reading a number of applications, such as Nadine will, you want to see a bit of a story threaded through the application about where someone's been and what they're wanting to do during the award. So I think the applicant research background is quite an important section for you to concentrate on as well, to just try and bring your career to life and also explain, because everyone's career is unique, what your journey's been to date and what your plans are for the future. So thank you for that. We've got a couple of questions as well around institutional support. So it's from 2 people about Nadine, if you could just describe, I mean, it is going to be different depending on the size, but what you'd see as a good package of support from a host.
So definitely I can tell you that merely offering to recycle the savings around the salary of the nominee is now really viewed by the panel as just not good enough. So again, if you think like the panel, which I always think is useful when you're going for funding of any sort, if you think like the panel, these are the precious top 5 for research professors. Obviously there's some global professors as well, but these are the top 5 of all of the fellowship schemes in the NIHR that they have to award. The NIHR panel and the NIHR view these as precious and highly sought after. So what they're looking for is a sense that in the application, the host institute really gets that it's an honor almost to host this person if they're successful, and that they should be doing everything they can to support this person's research area, research team, and research career, not just waiting for the NIHR to support it. And I suppose if I put it like that, it will help you see what might be possible. And what might you want to negotiate with your host institutions. The NIHR panel want to see evidence that the host really gets that this is a very special award. And so what does good look like? Good looks like a really well-articulated strategic plan that the host is going to add value on top of this research professorship around the nominee. That added value could look like extra posts, or could even sing and fly in terms of promises of development of research centres around that individual, and pulling them into strategic plans as new centres are being developed or new collaborations or alliances are being developed, that they see this person as pivotal to that and taking leadership roles in those things. So again, if you think like the panel, I think that will really help you see why just simply offering to recycle a salary is just not good enough.
It is an area that the panel are particularly keen to look at, and that there will be feedback that you get just in terms of a process side. Between getting your invite to interview and attending, we will send you the reviews that have come in from the selection committee and the external peer reviewers as well. So there may be comments there at the shortlisting stage where they feel this is an area to develop. So that is something to bear in mind, that you might get this feedback before coming to interview and then go back, to your signatories and the senior people that are leading your host and the partner organization to say, I've had this feedback, and what we don't want to see is a very good candidate let down by the host. So just bear in mind there may be that opportunity to go back and strengthen it and then come to the interview to say, we've taken the feedback on board and the host have proposed. Hopefully it doesn't get to that stage that you have to go back, but bear in mind there will be feedback received partway through the process. So the next one, Nadine, if you could spend a bit of time just talking about any advice on who you choose as your mentors, and that research support side of the award, and how you went about selecting those.
Yeah, and I suppose what I'll say is probably generic to all levels of these fellowships, not just the research professorship. Again, I think if you think like the panel, they want to see how the award will make a step change in your career. how will this fellowship make a step change for you? So if you only work with the people you've always worked with, if you don't use the opportunity to develop new collaborations outside of your existing team or existing institutions or existing collaborations, then they'll see that as rather limited. So this is the opportunity to think big. Who are the most amazing people in the world who are in your field that you haven't yet had the opportunity to work with, that you could work with, and use this fellowship to make those connections with? That the panel want you to really be visionary in terms of working with the very best people to do the very best research in your field. So I don't think there's any limit to choosing mentors. I think you just need to allow yourself to think big, to get out of discipline, to get out of institutions, and to really almost let all the boundaries that we normally have around ourselves fall away, and propose a mentorship team that are just going to be very well recognized. We do Google searches and PubMed searches in these meetings and beforehand. Who is this mentor? I've never heard of them. And and you're blown away by how amazing they are, because they're, this person's clearly chosen the top person in the field to really develop a mentorship relationship with. So my advice is think big, and use the opportunity of a fellowship like this to build those relationships with the best people in the world in your field.
Thank you. So just a process one that I'll answer. Jennifer Hall has asked if the positions for the postdocs and the PhDs are for individuals named on the application, or if they're recruited afterwards. The answer is it could be either. So you could have someone in the team that you think would be suited to start as part of that team, or it could be a vacant post that you're looking to recruit during the award. So it's either or is the answer to that one.
Yeah, and I did a bit of both. So I used some funding to support some wonderful folks that were already in my team, and I used some funding to recruit new folks. Yeah.
So a question from Matthew is around COVID, which I think is relevant across all different schemes. So the question is, COVID's disrupted many research trajectories, and recovery may take 2 to 3 years to show. How might the panel assess the different impact of COVID on applicants?
So there was an interesting discussion, look, at the panel meeting this year about the impact of COVID, and in particular the impact of COVID on the higher education sector, and whether that was attenuating some of that support that we discussed that the panel were looking for, because the university sector was perhaps just in a very different place because of COVID. And so I think the panel is sensitive to that, and sensitive to the difference that COVID is making across both the university and healthcare sectors. So I suppose all I would say, which I hope is reassuring, is that everyone will be affected by that. And so, don't feel that would significantly disadvantage you as an individual. So I would still go ahead and do the best you can, knowing that everyone will be affected negatively by COVID.
And in terms of the application, so we did have a section on there that was initially aimed at people who may have had career breaks for various reasons, and there wasn't opportunity in the CV to cover that. So there was a box to say, what the factors were. So we've broadened that out now because we're aware that COVID will have affected people in very different ways. So it's now a broader mitigating factors box, which I think is around 500 words or so in the applicant research background section. So that's an opportunity there just to say what the effects might have been, just to give a bit of context about the impact of what COVID's had on yourself and your career. So next question is from Jane. So the expectation is that this funds someone full time. So how did you deal with stepping back? I mean, I think you covered this in some of your slides, but if there's anything else you wanted to add about stepping back from your existing studies, and any other residual involvement that might have been over and above what the research professorship was funding.
Yeah, I suppose from my perspective, it wasn't a case of stepping back from existing studies, but stepping back from other roles that were going to be taking up a great deal of my time. That would mean truly I couldn't have done the research professorship program as well as those other significant roles. So in the ideal world, the existing studies that you will be busy working on will be all part of the bigger picture of your research trajectory, your research endeavour, your research vision. So I guess it gets a little bit trickier if you're involved in some things that are very left field than the research programme that you're offering the NIHR, in which case the panel may well ask, if you get to interview, how you're going to deal with that. But in the main, I would say the panel wouldn't be encouraging you to not see through the research that you're already leading, but to work out how you can deliver on the research that you're doing and build further upon it through the research professorship.
Thank you. So the next question is from Lucy. I'll give a quick answer in terms of what the NHR Academy's view is, but it's just noting, Nadine, that you were a professor when you applied, and that's reflected in your grants and the quality of your publications. So, you know, is the aim of the award to fund people at a less advanced stage of their career, or is that the expected minimum level? So in terms of the Academy's view, I'll let Nadine answer fuller. So it is open to all different levels. You don't have to be a prof to be it there. And I think it's what Nadine touched on, is about who's going to get the biggest impact from this award. So if you're, you know, a high flying prof that's been, you know, well established for a while, the impact might not be quite as obvious as someone who's, you know, maybe a little bit earlier and still working their way up. But Nadine, I don't know if you touched upon this in your slides, but I don't know if you wanted to build on that.
Yeah, so
impact that's
I mean, I had literally just been promoted to professor internally the year before I applied for this. I think that's quite a common stage of career that we see people applying, but we have also, I think, haven't we, Tom, funded people who are at the level below at senior lectureship stage and readership stage. Mm-hmm. So it's not that you have to be a professor already, but I suppose if you think of the competition, you know, if quite a few of those applications are coming in, and they're coming in from people who are at the end of their SL kind of stage of career, they're perhaps into readerships or very early into professorships, then I guess you do have to give some thought to competition in the awards. So yeah, I don't think you have to be a professor, but you probably want to be a very competitive SL or reader. Yeah.
Yeah, and I think whichever level you're at, it's trying to make it clear in the application all the way through about what impact and how it's going to make that step change, because I think that's what comes up at all sections, whether that's shortlisting or interviews, about making it clear to the committee that you're at this level and this award is going to take you to, you know, this level and really set you up, rather than just, you know, you want funding for 5 years. So that is a very key point. Thank you. So there's some quite long questions. So one, I think, is specific to our area of research, Nadine. So a bit an opportune time. So do you think there was an element of good timing, not good luck, good timing that contributed to your success in the early stages of your career? So there was arguably a paucity of your type of research back then, but relatively speaking, there is less funding around now, and the field of MSK research is more saturated. Any thoughts on that particular subject?
Yeah, look, I am originally from Ireland. I do believe in luck. I think there's always a healthy dose of luck and being in the right place at the right time with these things. It's incredibly hard sometimes to know why some things get funded and some things don't. I think in my field in particular, Gordon, also in yours, I do think that it's harder perhaps to demonstrate novelty or demonstrate you're adding something that others haven't already added before. So I guess that would just need very careful thinking through in curation and development as part of an application. I don't think it would be impossible. You know, we're seeing, you know, very big grants going to musculoskeletal pain still, both in the UK and elsewhere. So clearly, others are making compelling arguments still, even within a field that is now perhaps more saturated, to use your term, than it was previously. So yeah, a bit of luck, but also probably a bit of curation of the vision and the story and what you're selling to the funder.
Okay, thank you. So we just got a couple of minutes left, so we'll just try and answer a few quick. I'll just answer Jack's question quick. I think we've touched upon it. So Jack is a statistician, so as a methodological researcher, just wanting to make sure that allowances are made. But I think Nadine's covered this in previous slides, but I would say that if you look at the list of recently funded professors, we have 2 statisticians and a health economist in the last couple of rounds. So those were the first ones. So hopefully we're getting a bit of momentum. And it's one of those, you know, if you can see it, you can be it type of arrangement. So certainly methodologists are being funded, and that's very good. Something that we want to see. There is one around global health, which from Merlin, I might get in touch with you. It's just in terms of is there an intermediate fellowship, because there is an advanced fellowship for global health. I would suggest, Merlin, if you could get in contact with the Academy-Awards email address, we can maybe discuss that offline. There's one around the 5 years eligibility. We're aware that, you know, that would have been impacted potentially by COVID, and promotions may have been delayed. I mean, what I would say, it might affect that your current ability to apply. I mean, it does reset if that promotion does come about. But what I would suggest is that if there are certain circumstances, again, get in touch with myself and the team, and we can discuss, you know, that individual circumstance at that point. So I think we've got 2 left. So one's from Manjit, talking about what did you feel you were able to achieve that you wouldn't have been able to do with this award?
I guess it's so hard to answer that question, isn't it? Because you don't really know what would have happened had you not got the award. I suppose what I would say is that I can't help but believe that when my NIHR programme grant application went to the Programme Grants Committee, I can't help but believe that it would have helped a great deal for them to be getting this application from one of these new NIHR research professors. They were relatively new at the time. Of course, I was in the first round. And, you know, I think timing and, you know, it's a bit like, you know, the story of grants. You wait and wait and wait for one to come along, and then they all come along together. And I think having this award, which is the top NIHR fellowship award, it probably has done all sorts of things that I don't even know about, because those would have been discussions behind doors and funding panels, or behind doors and committees, when they were thinking of who should we get to do X or Y, or who should we invite to this. So I think it's all of that added value holding one of these awards that it's very, very hard to put a metric on, but I'm absolutely sure happens. So I think I may have been able to still excel in research through getting other grants, but I suspect strongly that the networks, the invitations, the added value, the NIHR reach out to get involved in things, all of that would probably not be the same at all.
Okay, well, thank you very much, Nadine, for your time. I greatly appreciate it. And thank you, everyone, for taking part and asking questions. There were quite a few that came in late, so I'll try and type those up and publish a Q&A document. So we'll leave it there, and there will be a survey that follows this where you can indicate if you'd like a copy of the slides. So I'd just like to say thank you again to Nadine, and I hope to hear from lots of you with
Thanks everyone for joining. I hope it's been useful. Bye now.
Thank you.